Available statistics from the Ministry of Health indicate that about 50 nurses and midwives have succumbed to COVID-19. 16 doctors have also died. The Workers' Compensation Act of 2000 required that such workers are compensated by their employer.
Their families are there, crying.
Section 31 of the Act states that if a worker becomes disabled or dies of any disease mentioned in the third schedule of the Act, it shall be presumed until the contrary is proved that the disease was due to the nature of that employment. The Act states that the liability to pay compensation lies on the employer.
Uganda Nurses and Midwives Union calls upon government to release risk allowances to nurses and midwives of Uganda. This is a right, not a privilege.
The union is proposing compensation of 80 million shillings for those who die in line of duty.
This is because the cost of getting a body from the private hospital now is even almost 100 million.
The Minister of Health, Dr. Jane Ruth Aceng, has allayed their fears, saying plans for compensation are in the pipeline.
For the health workers that lose their lives in the line of duty, the Ministry of Health always prepares their details and submits to the Ministry of Gender, because Uganda has guiding regulations for compensation of those that lose their lives in the line of duty. And so I think in due course the Ministry of Gender will be communicating as to what will happen to these people. But we are expectant that their families will be compensated according to the law.
A report by the Minister of Health as of 2019 June 2021 indicates that so far 2,635 medical workers have been infected with COVID-19. 768 health workers were in Kampala, 160 in Mbarara, 100 in Wakiso, 95 in Gulu, 89 in Tororo, 62 in Masaka, 61 in Kasese, 52 in Jinja, 50 in Arua, and 49 in Adjumani. Jingo Francis, NTV.